political activist through his songs. Politics, then he was buffing it long ago, doing it in different styles. Back here in Studio 4, you're 18 to the top of the hour. The conversations about floods and its attendant problems and challenges is one that continues to stare us all in the face. And so if you cast your eye across the different approaches and the many things which are being done to help provide a bit more in terms of relief, is dominating the conversations. But we here on the 3FM Sunrise, I've also looked at a critical aspect of it all: health. And if you recall, yesterday we began conversations as well with the immediate areas where market women were threatening to sell flood-infused items to unsuspecting public, to the unsuspecting public. Flood-infused, contaminated items, food produce and some others. And we were getting a bit more in terms of caution as well. We're going to continue that leg of the conversation today for you. Because they say a wealthy nation is a healthy nation. Isn't that what it said?
Yeah, that's what people say.
A healthy nation is a wealthy nation.
Exactly.
So it's
if you're not healthy,
if everybody is sick. In fact, it was one of the many things which when COVID struck became the basis upon which the lockdown was necessary, and it gave the president then, Nana Addo Dankwa Akufo-Addo, a lot of plaudits when he said, we do not know how to bring back the dead. We can bring back the economy. I've forgotten the exact way he put it. What we know how to do is bring back the economy, but we cannot bring back the dead. And so let us stay home. Let us exercise and follow the necessary safety protocols and what have you. And so health has always been one that in terms if you're looking at the well-being, in fact, in terms of the indices for a developed nation as well, it's one of the things which is looked at. How healthy are your people? The life expectancy of your people as well. There are things that are factored into the conversations. The health minister, Kwabena Minta Kando, since the flood, we understand from the Ministry of Health, went around a number of the flood-affected areas. And so they issued a statement in that regard, advising Ghanaians to do a number of things. I have excerpt of that statement.
That'd be fantastic.
And so I'm going to read that.
Oh, that'd be lovely.
Right. So it reads that the Minister for Health, Kwabena Minta Kando, has undertaken field assessment in the affected areas, including Sickle VIP, New Plant Station, and Achimota, Alogboshi community, to evaluate conditions on the ground, facilitates the rapid deployment of appropriate interventions. They go on to say that the minister has directed the Ghana Health Service to intensify disease surveillance, scale up risk communication, and strengthen community-level interventions in all affected districts. Health workers have been urged to deepen public education on preventive practices with support from the media, traditional and religious authorities, and educational institutions. That leg we are going to follow. The ministry further calls on all metropolitan, municipal, and district assemblies to collaborate closely with health authorities to enforce environmental sanitation measures and reduce public health risks. Food vendors are required to comply strictly with food hygiene standards. The public is advised to clear drains, remove stagnant water, and maintain clean surroundings. The first part about food vendors requires enforcement. Because if you leave them,
of course,
they will do what they want.
Mawina.
So that aspect,
the food vendors conversation
ought to be mentioned. And mentioned strongly.
The food vendors matter is a serious thing. And you see, It all boils down, like I said, to structures. We lack structures in this country. So you can find a food vendor here, 10 meters another person, 5 meters another, 6 meters, 20 meters another. They are all just scattered around. We can't put them together at one place. So it makes monitoring quite easy.
You know, there's a video of when the flood hit.
Yes.
Tony Goodman is public relations officer of the Ministry of Health. He's joined us via the phone lines.
Oh, all right. That's beautiful.
There's a video I saw of a woman who was selling wachi.
Mm-hmm.
The area was flooded. The water was knee level high.
Yeah.
Above knee level. And she was still selling, and people were in the water and were buying the wachi from her.
Yeah.
But Mr. Goodman, good morning to you, and thank you very much for joining us here on the 3FM Sunrise.
Good morning, right now. I'm grateful.
Fantastic. It's great that we're seeing the ministry issue a statement in that regard, asking for a number of things to be done. In the immediacy, do we have an understanding as to what has happened since this statement was issued, or even since the flood came about and experts or persons began to warn of possible health crisis in the offing?
Thank you, Marina. Good morning to our listeners. Yes, before the rains even began, we issued a statement alerting the general public, letting them know that after every rains, normally in Ghana we have diarrhea, diseases like cholera and the rest. So we should all be careful. So that statement went. We followed up and map up. We normally have cholera-prone areas. We map our strategies clearly how to deal with them. And then we're monitoring until this day that we got this heavy flood. Quickly we moved. The minister invited Ghana Health Service for briefing. When they came, he said, no, I'll be better placed if I go to the field before you give me this briefing. So we went to Sickle. He used the opportunity to talk to various vendors, talk to some community members, and then from there went to Agbobushi. Agbobushi wasn't a good site at all. Alogboshi, sorry. Alogboshi wasn't a good site at all. We decided to come back to the office and look for logistics for facilities closer to these cholera-prone areas so that they would be able to assist persons that may come with any of these diseases that comes with floods. So that's what we have done. But again, we realized that during our field visit, a lot of people were still in the mud trying to get their wares, get their belongings here and there. And we know that mostly diseases are associated with these practices. So we've issued that statement to caution people, let them know that we are not in normal times and they may pick diseases back home. So, Marina, that's what we've been doing. We've not slept. We've tried to make sure that we get some responses during this period. It's devastating. Some of the places we went to, yes, as you said, people are still selling closer to gutters. Those who were helping others to clear their homes were buying these foods around, and we realized this could cause disaster. Thankfully, our sentinel centers, various hospitals have not picked any outbreak yet. We pray and hope that we don't get to that level.
Right. The prayer and hope is that we don't get to that level. And you've mentioned the bits about persons still selling. There was open threats, if I can call it that, by some market women in and around the Odona area that, look, they are going to sell their produce despite some of it being submerged in the flood waters. My colleague Armstrong was there. They were cleaning some of the food items and hoping to sell them again. we hear you on preparedness and advice and all of that, but that is a direct threat to public health. That surely will fall within the remit of the ministry and then the Ghana Health Service as well. Is there action being taken or something being done to go to markets to, I don't want to use the word confiscate, but prevent a possible sale of such produce to unsuspecting customers?
Yes, so this will fall directly under the Food and Drugs Authority, the safety of foods we eat. So normally after this period, they go around. The directives the minister gives, he gives these directives to the agencies under him. So we hope that they will go around. We know that this period, obviously, some of the places we keep these foods in the market may have also been flooded, and this food you have there are not wholesome anymore. It's better for us to go into the market and get them to understand what to do. But the person will ask you again, are you going to pay me? And all that. In every community, every market, you have our officers, the metro directors, the district directors there. So these directors would carry out the minister's directive. What we would do after is to get the Public Health Division of the Ghana Health Service to do another briefing for us to know where we are. Now, immediately the minister issued directives. They went on the field, and I'm sure they are still out there trying to get people to understand what is happening, get them to know that if you flout all these orders, all of us may be in danger. But because you know where your wife is bringing any of this produce to your home, so it's a dangerous practice at this time trying to sell all of these.
I know Accra is not the only place where we experience floods. There were parts of the Volta region. We've seen Cape Coast in the past as well. What is the updates that the ministry has received in relation to all of these other areas, as with the necessary safeguards that has been announced?
That is what I was just saying earlier, that we have prepared because we know that immediately you have this magnitude of rain, floods here and there. It comes with diarrhea diseases and all that, cholera. So we have prepared. But fortunately for us, we have not picked any of these outbreaks in the cholera-prone areas yet. But we are monitoring the situation. The minister directed that logistics should be provided to these hospitals to prepare themselves for any outbreak. So we are ready, but I can tell you that we have not recorded any case as yet.
Right. Mr. Goodman, I'll thank you and get on to the other line, because thankfully the minister is expected to undertake that duty. The Ghana Health Service, they are also joining us. Dr. Franklin Asidu Bekwe is joining us on the phone lines as well. So, Mr. Goodman, thank you very much for speaking to us. He's the PRO of the Ministry of Health, providing a bit more in terms of the minister's directive. But like I mentioned, Dr. Franklin Asidu Bekwe is a friend of Media General, 3FM and TV3. He's in charge of the Public Health Division of the Ghana Health Service. He's joining us as well. Doc, appreciate you greatly for making time to speak to us as well. There is a concern that we could see disease outbreak, not just cholera, but so many others, considering that, look, around Sickle, the Awudome Cemetery was flooded in itself. It will get onto the other flood waters, and it will all be mixed up and all of that. In terms of our alertness, where are we as we speak, please?
Okay, thank you very much, and good morning to your listeners or viewers. Yes, so following the flood, there are possible conditions that may occur because that the flood water is, I would say, a very contaminant source of disease. So we be having diarrhea diseases that may include cholera or typhoid. You may be having incidents of malaria cases, maybe 5 in excess of what we get. And then you may have snake bites, you may have even injuries. So those are the risks that we anticipate. So one of the things that we do, or we have been doing, to make sure that we heighten our surveillance. So we have what they call the acute watery surveillance system in place, whereby you have thresholds for particular diarrhea diseases. You want to see, because clearly we are supposed to be reporting diarrhea cases, but then they shouldn't exceed a certain threshold for you to cause an alarm. And then we're also looking at our lab systems. So if people come in the facility with diarrhea, that may lead to dehydration, that may meet our case testing for cholera, then we are testing them for cholera. Now, let me say that the last confirmed case of cholera in country was April 2025. So we have not confirmed any case of cholera, but there's a risk. So we are looking at it. And I think that we need to communicate to Ghanaians that the risk is there. And any water that you take or you are exposed now predisposes to a risk. So you need to be careful about what you eat and what you drink. So what we are saying is that make sure that any water you are taking in is treated. So it's either that has been boiled or you have aqua tablets or chlorine tablets imbibed into it. And then anything that you want to eat raw, let's say fruits or vegetables, make sure that you actually wash them and wash them well. And then another issue is that because we are looking at more fecal oral diseases, make sure that now you are washing your hands regularly with soap and running water. Another issue is that because we are going to have high incidence of malaria, people should make sure that they are sleeping in the bed net. And also we need to prevent ourselves from getting malaria. So now that, let's say, the water has receded, any receptacles that contain water, we need to make sure that we dispose of them so that we don't breed mosquitoes around our area. So as a health service, we're also going to make sure that we heighten our awareness creation on the prevention of malaria disease and then malaria. So basically, those are the issues that we're doing, but I think that is going to be a long haul. So it's not just a one-off activity, and we are going to continue.
It's important you mentioned that long haul, because my next question was all well and good, and education is going to continue, and even we here as well have been talking about this since yesterday. We've done reports on TV and the likes, advising the citizenry against eating from any place and all of that. What is the time frame with which, if there could be an outbreak, we can begin to see? Because there's a temptation that after perhaps a week or two, persons can drop their guard. And so this week, amongst a circle of friends in the office, the decision is that, okay, this week we don't buy food from outside. Let's wait till next week, then we can begin. Is that good enough a decision to take? Or we should be looking at a month, 2 months where we're saying we're staying away from certain areas and certain things, and we're being wary of what we're eating?
Yes, so I would give you a time frame. What I want to say is that we are preaching good personal healthy behaviors. And if you listen to what the Met guys are saying, the rains are not going to stop now. Maybe the intensity will reduce. So what we want to see, the risk of cholera still exists. And even last year, we didn't have any profuse rainfalls or plants, and we get cholera. Because the risk factors for cholera still abound. Certain cholera is about the potability of your water and the sanitary conditions that we live in. I don't think there's much of optimal conditions that we are in for you to say that we are fine, we can do what we want to do. 40 years ago, UK had cholera. Now you don't really see cholera because they have potable water and the scientific conditions are better. So until we have such a fine system, I want to urge Ghanaians that let's be careful what we eat and drink. Let's not assume that the flood came last week, so we can still lose our guard. So please, this intervention, the most cost-effective intervention is hand washing with soap and running water. That one, it does not depend on whether you have flood or not. So make sure you are washing your hands almost every time you soap and running water. And then maybe the second one is the sanitizer. But to me, the ultimate is the hand washing with soap and running water. And then also be sure that everything that you're eating is hot. It must be hot and as hot. If it's fresh, then you must make sure you wash it before you consume. You see, let's say you are sitting in a tuk-tuk and you are going from Sickle to maybe Virginia, and you see some apple on by the roadside. You just buy it and immediately decide to bite into it. The person who is selling the apple, do you know what has happened to his hand? You are not sure because you don't know where he passed before he came to give the apple to you. So what I want to say is that let's be very cautious where we are now, and everything that you eat coming to your mouth, which is fresh, make sure you wash it. You understand? And then if you want to consume any food, make sure it's very hot.
Right. Doc, I'm here with my colleague Patrice. He says he has a question, and then I'll return as well to you, Patrice.
Yeah, Doc, thanks so very much for your time and that you're spending with us here. I'm going to read, if I may be right, two core mandates of your institution. So health promotion and social behavior change is one of them, right?
Yeah.
And then environmental health and sanitation is another.
Yes. But you know, when you talk about environmental, it's somehow under the local government. It's not fully under us.
Okay.
But
so
we will promote good behavior.
Are you mandated to coordinate with the MMDAs to support the district assemblies on waste management, road safety, food safety, water quality, control of disease, and all that?
So food safety is broadly under the MDA, National Assembly.
All right. Okay. So behavioral change. I am saying this based on the fact that we're talking about food safety and so on and so forth. Has it come to your attention that the way our markets are structured is wrong? The way we allow people to sell just anywhere and anyhow is wrong, and it is dangerous to the health of the citizens. And if so, if you have identified it, do you have any reports that you have written on these things and how we have to adapt to better ways?
No, so you see, at times health bears the brunt of the way the systems are set up. Setting up markets and those things are not directly under really they are under looking at local government and other ministries. So we actually give guidance or we give technical advice to certain ministries, but we do not directly influence the setting up of markets and all those things. So clearly, I think that, you see, we want to discuss.
Sorry, Doc. I'm not saying you have a direct hand in it, but I'm saying that per the occurrences and incidents that we have experienced over the period of time, including cholera and so on and so forth, I am saying that if you know that is the local government that is responsible for all these things, from the health directorate point of view, the health division point of view, aren't you able to make an input into how they are supposed to establish and create these markets and giving them maybe delineations? It is only 200 meters. Make sure the community is so and so. Establish it on high grounds. Place it here. Do you have the mandate to do that by contributing to it? Rather than we waiting until it happens, then we are giving out all this information.
No, so if you go to the districts, the assemblies, we have committees where health is part. So they make influence or they give technical advice to the setting up of these structures. So yes, at the various assemblies, we have the health committees who are part of the social service committee, and they give the input to it.
So that means they're not doing a good job then?
Who?
Those are the committee level, the health committee level at the assembly. Because if every now and then, whenever there is a flood, We need to come back to the public health division to say how people should handle this.
So what is the challenge? Let me get the clarity. What is the issue we are discussing?
To prevent all these things. So, for example, if markets are put at one place, so that we don't have food vendors scattered all across, it will be easy for communication to go to just a group or a particular location. But if we don't manage how the planning of these social enterprises, which is the markets, are done, food vendors and all these food health challenges would become a big problem for us every now and then.
Yes, so you see, food vendors, some of them are being hawkers. So you see, I think that when you look at a condition like cholera, they call it challenges in social development. It's a very broad topic to discuss. See, and let me say it that because it will manifest as a disease, it becomes a burden for the health system. But it's a holistic approach to solving development issues in countries. Do you get? So you can even decide that somebody has the person who is walking around selling apple, it's not even in the market. Yes, so you see, there are two things here. There's an individual who has a personal role in preventing disease. Before you also look at the government or the external. So if you want to prevent disease, it's two ways. So it's either regulatory or personal change or behavior change. And as I was saying that now we go both ways. So I look at it, it's not we and them, it's we. Everybody has a role. The media has a role, the health sector has a role, the ministry has a role. And as I'm saying that as an individual, your key role is one, make sure that whatever you are taking in, it's caught. That one, you cannot go and blame any government. You as an individual, or before you are dead, before you come in place, blame any government. What we are saying, who is directly under us as the health sector, is that anything that you are going to eat now, make sure that it's hot. Anything which you are going to take in, which is fresh, make sure that you wash it with hands, with soap. No, you make sure that you wash it. And then anything that goes into your mouth, make sure your hands are washed with soap and water. Those things are individual. You are in charge. Nobody can force and put something in your mouth. So that one means easy. The other ones are external, which are maybe complicated. So I think that for now that we are in, we have this emergency state. Let's handle the low-hanging fruit. And as I'm saying that one, I don't know your name, but I've forgotten your name.
Patrice.
You can take charge.
That's Patrice.
You can take charge that Patrice, I will never eat anything cold. Patrice, I will never take any fruit without washing it. Patrice, I wash my hands with soap and water. I mean, to me, that is crucial for now. Later on, we'll handle the medium and long-term issues. And I think that, to me, let's move not tangent. And then later we can discuss the other issues.
Right, Doc, in following from there, the districts and municipalities where you have reps in, what is the collaboration? I'm always back to, not collaboration, but direct supervision. That's the word I'm looking for. Direct supervision as to the work they will be doing around this time where there is the possible risk. I know the health centers are prepared to take on the challenge of should the cases come, but there's also the preventive bit as to education on the ground as well. What is it like at this point in time? Because I was asking Mr. Goodman about some markets and persons, the market women telling us that, the produce they have, yes, floodwaters may have been submerged in floodwaters, but they want to sell it because they don't think anything has happened to it, amongst others. That's where the education bit will come in as well, and you have a certain supervisory role as well with colleagues within the district and municipalities.
Yes, so Ghana has an emergency management structure. I mean, that runs from national to region to districts. So what is happening is that the various, based on this, and I'm sure to come out right there. So when you have, let's say, a very big outbreak, we have emergency structures that are activated at all levels. And then normally, based on the structures that are set up, let's say at the district, is the DP who is the incident manager for the command. You understand? He has the structures at him or her. The health sector's role is to make sure we promote education. You have and make sure that we hygiene surveillance. And as I said, these are early stages, but you can hear a number of health workers going on. It's going to be intensified. And I want to state that it is not a one-off thing. It's going to be sustained, very heightened time. And I'm very happy. When your colleague called me, initially I was working on a report. I said, no, let me stop and get this thing sorted out. So it's something that we're going to continue to make sure that the average Ghanaian sees that it is not something that is going to end in the next 2 or 3 days. For now, let's assume that we are being exposed to a threat over a period of time. And we need to be very careful whatever we are eating and drinking now. So our system started, but we're going to make sure that it's going to continue. For us, the key thing is the surveillance part. What I'm saying is that we are monitoring the threshold because we expect cases of diarrhea to occur, but it's not quite across. And surveillance does not end; it's continuous. So if let's say you have your diarrhea cases going above, it's a source of concern. Where are the cases coming from? What is happening? Then we put in diminishing intervention measures. So it's an ongoing work that we'll be doing with you, and we are grateful for your support.
Doc, we're grateful as well that you made time to speak to us. I'm sure we'll engage a bit more in the coming days and months as we continue to partner in helping provide direction as well in relation to public health. But I appreciate you for joining us, please.
Thank you, sir. Have a nice day.
Yes, you too. That's Dr. Franklin Asiedu Bekwin. He is a director in charge of public health at the Ghana Health Service, joining us this morning. Dr. Dennis Borte is a public health physician and medical director at HealthNet Swan Medical Center as well. I'm just going to go on to the other line and pick his thoughts in relation to this as well. Doc, you've been listening into our conversation and what we've been talking about. It does appear it's cut out for the ordinary person as to what they should do around this time so they do not become a part of statistics in relation to cholera.
Thank you very much, Mawena. And that's very true. In times like this, caution is a word that should not be, we can overemphasize caution in times like this. As much as I have to go out to those affected directly or indirectly, and we would also wish to state unequivocally that in times like this, subsequent to such floods and such disasters, what could be in the offering is like my senior colleagues have spoken, the propensity for diarrheal diseases to be on the rise. Apart from diarrheal diseases, skin diseases can also set in, and like they said, with settling of water or collecting of water in places, puddles like that, you could also have more breeding grounds for malaria. It becomes important that we become cognizant of this and therefore put in the necessary preventive measures. Like you mentioned, it is the individual who has to take the ultimate responsibility. If you look at the sheer load of filth that has with the optics that we saw, and of course this is not the first time that we have seen such optics. Probably this may be one of the worst we have seen. And Ghanaians are well alive to this. We see this all the time when it happens. And yet we haven't changed our attitude. I mean, it's for now, we can at least take the caution that let us not suffer the health consequences that could arise from this. So indeed, it is for us to, as individuals, to take the necessary caution in order to address a bigger crisis. And cholera is one of the things that could happen. And the worst cholera epidemic I ever saw in my practice was the 2014 episode. And who said it cannot happen again? But when we take the needed caution, I think we can go a long way to reduce the incidences of such diarrheal diseases that could arise, typhoid that could arise. And you know that with this, the passage of this filth, which you know it contains some human excreta, all kinds of water and sewage all mixed together. Some have actually run into people's rooms and homes. Some have run into people's shops and house. So a lot of things have been deposited along the spot. I was driving on the Graphic Road yesterday, and the amount of plastic waste that are hanging on the rails by the road. I mean, it's such a messy sight. Now, assuming we're able to bring off all these plastic waste of rubber bags that are tied to our rails by the roadside, it means that other debris, including fecal matter, including sewage, all these are all over on our roads. And people obviously will be walking and holding and touching these things. And you are likely to carry something that is not visible on your fingers, and you could put it into your digestive system, and that is what is going to cause the trouble. You might end up depositing things on the surfaces, and other people would touch them, and then infections begin to spread. So it's time that we are all alerted that we need to exercise the greatest of caution in what we eat and how we eat what we are eating, and also to make sure that we do not walk or wade in water that is running all over the place, flood waters for that matter. And therefore, one thing that we could also do is to make sure that we are washing our hands frequently as possible. It's not only under COVID that hand washing should be seen as the ish thing. Under all circumstances, and especially in times like this, frequent hand washing becomes important, because you'll be shaking hands with people, you don't know where they are being, what they are held, what they are touched, and then you pick up infection. So that's my preliminary comment.
No, whilst this education has become important, sometimes the concern which I have is that for the persons who are down there at the markets and what have you, we do not see them practice any of these. And rarely even do we get education reaching them, because they become the start point for which, if there will be a crisis on our hands, we'll see that play out. What will be your expectation of the persons in charge of handling this potential crisis now, because it's not a crisis yet, we're seeking to prevent, in being able to go down to the market and to other areas in helping to prevent? Would you want to see Veronica buckets, perhaps in and around our markets? Yes, we can argue about the structure and the make of our markets, but a bit more hands-on to help prevent a disease outbreak.
Yes, Mawena, I think you are right on spot. So, fortunately for us, this kind of prediction, we know that every year around this time of the year, things like this happen. So, emergency preparedness is important. And before we get into the rainy season, our public health system would actually raise the antenna and be more proactive in getting to these markets, and or with the help of NANBU, when these things happen, these Veronica buckets you are talking about should be, scattered all over or dotted all over the place in such places, so that people can frequently do that. And again, the public education. I know that some citizens, no matter what, will be recalcitrant in trying to do the right thing. But when the public education, the market is special, because you go to the market and they are one of the places that are mostly flooded with all these debris going there. And like you're saying, some people have decided that no matter what it is, they will still going to sell their food or their items to people. So apart from the NADMO, the security agencies must also be ready to pick up people who want to be recalcitrant and put the lives of people at risk. So public health nurses are in there, public health personnel are in there to go around indeed to make sure that education and caution goes right to the core of the places that are likely to be the point sources of infection spreading into the community, and make sure that the education goes down. Apart from that, law enforcement, people would like out of greed, out of the fact that I don't want to lose the money I've invested in this food items, and so I must still get my money back. And sometimes when these disasters happen, people must also be given the assurance that, well, you may have lost something, but where government can come in and compensate so that if that is there, then nobody will say that I will still have to sell the infected or infested or affected material to the public. So it's a matter of different approaches. Both the food and drugs authorities have to step up. And these are all things that we need to plan even ahead of the rains coming. That if this to happen, this is the action. If this will happen, this is the action. But it's a whole trail that all departments or all agencies involved must be up and running at a point like this. So public education on the market especially, and security agencies for those who will be recalcitrant to be able to want to sell. Just like we know people, even when it comes to fuel, there were times people would be selling contaminated fuel. I mean, glee, with so much glee. And it's like people know that in Ghana you can go scot-free almost anything you do, you know. But when we have law enforcement, people know that they can be punished for this. Then people will sometimes say, but sometimes we are too lenient. And, you know, we look at the fact that, there's a disaster, so, but irrespective, when people also have the assurance that if I do wrong, I'll punish for it, or even if there are losses, at least there's some compensation that will be, at least to help them put body and soul together for the meantime, because it is life. Force majeure happen, and people, accidents do happen, people lose stuff. But sometimes when there's that help that will come from somewhere, it ameliorates the pain, and I think that is how we need to go.
Right then, Doc. I appreciate you for joining us as well in contributing to this conversation this morning.
My pleasure.
Right, that's Dr. Dennis Borte. He is a public health physician and medical director at HealthNet Swan Medical Center, joining us this morning as well. I'm going to come in studio to Patrice just before I go on my next break on all of what we've been talking about and if we can make it work, right? Because we're big on prevention now, and hopefully we do not see that outbreak. Doc mentions that 2014 cholera outbreak. I suffered one around that time. Yeah.
Okay.
Sorry for you. It's a story. It's a story that I tell whenever medical negligence comes up. Mm-hmm. And we're talking about our friends who take care of us, but sometimes some of their colleagues do not do the absolute best. I experienced that in 2014 when I suffered cholera. But hopefully we do not get there, because that was on such a wide scale.
Yeah, exactly.
That was on such a wide scale. They had to burn every clothing that I was on when I went to the hospital.
Oh, really?
Yes. Because if someone comes into contact with it and the person doesn't wash their hand,
there's a high potential.
They have cholera. So those are the dangers.
So I'll start off from the top. I agree with a lot of the things that they have said. But like I said, majority of these things are things that are, what we say, book knowledge. These are things that will guide everybody when you follow a certain rudimentary means of doing things. Yes. So most of us have forgotten, but when it got to when we had, COVID, the health sector recorded very minimal infections, because we had to adopt the hand washing and then the restrictions to handshakes. So hand washing, handshakes, and not taking your hands to your face, which you do 2,000 times in a day. You don't know, but your hand touches your face a lot of times. So during COVID, a lot of these infections were drastically reduced. And this food infection also was reduced because we're not shaking hands with them. So I think those are things we need to get back to. So I try as much as possible to restrict myself from shaking hands with people. Somebody may think that, you are trying to be something else, but please.
A little too normal.
Yeah. I mean, I like it that way if I'm to prevent myself from getting. But what I want us to resolve is, what are the considerations we need to take when it comes to health matters? For me, it is not about After the rains, there'll be water collecting in certain cans, certain gutters, certain holes, all these things. How do we resolve them? Should we still keep the open drains, or we should not? Should we ensure that every community has a drainage system, or they should not? Should we ensure that all our gutters are desilted and they are giving direction as to where every wastewater would go to? Is the assembly ready to set their task force in place to visit areas where people, the moment they sense that it is going to rain or the cloud forms, they just discharge their waste? And I can point them to places that I know directly in my neighborhood where they discharge waste onto the road just because clouds have formed and rain is going to fall. So in all these things, when the task force doesn't move from house to house to ensure that everybody is doing accordingly, you have your septic tanks, you have your what we call the suckerways, we have all those things, you have drainage systems that will take the water from one spot to the other and will be guided into a bigger drain that will not overflow its banks, because according to the engineering technology, what you have to do is that it is deeper, it is wider, and it is directed, and it's got the slope to go to a place. If all these are experts come out to say around this time, this is what you have to do, and then the people who sell at markets, what markets? What food joints? How do we ensure that people manage their foodstuffs? How do we ensure that? How do they package it to sell? So why would I go? I made mention of this. Why would I go to the mall? Why would I go to the big supermarket or the mega market, and I would see how food has been packaged under hygienic conditions? Yet when I visit my local market, it is just on the floor. Who knows where it is coming from? Go to the Ashaman market. Go to the Ashaman market. Go to the place called Kwasiajaso. Go to Makola. Go to Kaneshi. And you think that all these ways that had water collecting around them, that people in their stalls would come back to meet, would not just be cleaned up and handed over to you? For me, I say there is a larger conversation we need to have concerning stratification of where markets must be, where food vendors must be. So dotted along the East Legon road from Emmanuel Eye Clinic all the way through the Abedipele Lane to what we call the Lagos Avenue, everybody is selling roasted plantain, roasted plantain, roasted plantain. Can we aggregate them at one place? Can we say that this is a place we have demarcated? So if anybody wants to buy, they all come there, so that you can easily walk to them and advise them as to what to do. In fact, are they even supposed to be there at all? Are they legally mandated to be by the roadside? So if we are not able to coordinate these things properly and speak to them per report, I always like blueprints. I like blueprints. What is it that we can do? What is Europe doing? What is being done in Canada? What is being done in America? What is being done in Denmark? What is being done in Holland? What is being done in Hong Kong? Such that they don't face such health risks every now and then.
Right.
So we don't manage our foodstuffs. We don't manage our food stock. We don't manage the food management in Ghana is poor. Market structures, very poor. So everybody thinks that if it's not on the ground, it is not food. You're not buying from the market, which is very wrong. Food is not covered. So those who buy the grains, our roads are not tarred. So there's a lot of dust on our roads. So you like Hausa Cocoa, right? You enjoy Hausa Cocoa. I know very well that you enjoy Hausa Cocoa. Hausa Cocoa is done in the open. And when the wind blows, it carries dust. Do you know what is in the dust? Somebody suffering a certain disease. They spit out something. It dries up. It becomes part of the dust. Somebody pees just around. It becomes dry. It is part of the dust. It blows into the Hausa Cocoa that you're going to eat because it's done in open space. You buy it and you drink. Now you start getting certain diseases and you just don't understand it. People sell wache, and what I can't stand in my life is friends, educated people, expose people who say that watch it by the gutter is the best.
On that note, I'll go for this break. That's Patrice on the back of public health concerns, right? Public health concerns here on the 3FM Sunrise. When we're back, our friends with sickle cell are asking for a bit more in terms of support around this time. We'll hear from them and hear what the concerns are and see if that can be managed, right, by employers, amongst other things. Stay with us.
When I wake up in the morning, I brush my teeth with Kel Charcoal toothpaste. This gives me
The Electoral Commission has reiterated its commitment to organizing free and fair elections this December.
How's your week treating you? I'm here to serve you great music tidbits for your at-work listening pleasure. Rastafari, Rastafari, Rastafari. Our Father, who art in Zion, Kanamawe, Kanamawe, Kanamawe. Oh, turn it up!
Come into the mountains. Sight and I grandfather.
It's time to drive you home in style with great music, the 411 and all your favorite songs, what's happening around town, and so much more.
And in the headlines today, the two leading political parties have been addressing the public on allegations of corruption. The Black Stars coach has unveiled his squad for the upcoming games, and there are some interesting names. Pull up! The weekend is here and it's time to turn up. Get your dancing shoes on, Lego. We really do have it all. It's a premium mix of information and entertainment every single day on 3FM 92.7, your urban lifestyle radio.
The Electoral Commission has reiterated its commitment to organizing free and fair elections this December.
How's your week treating you? I'm here to serve you great music tidbits.
in the silence. Something was growing. The journey continues. They calm before.
the songs by DJ Phil. A number of
He's
them
now
have been
Dr. Phil.
a number of them have been sending messages as well.
Yes. So to Vanessa of Smoothie Bar and Grill at Amasaman. Yeah, she's enjoying the songs that you're playing. And also to Kwesi Ado and Duke Anthony Essien. They are all listening. And Elizabeth Dede Adi of Ghana Prisons. I think, yes, she's also listening together with Eche. They all work at the prison service.
There's a funny story told about the prisons.
Yes.
That some people don't like to visit because when you go and your card gets missing, no matter what you say, you are a prisoner. And so
they should check their books.
They don't like to visit prisons. In fact, when we were talking about this one time in the office, some of my colleagues were sharing the hey, Master, me where I'm from, I can't go there. Everybody else will have their card on them, and mine will go missing and all that. So yeah.
The final one is CEO of Serenity PNL Ventures. She's Mercy Ando.
Mercy Ando.
Yeah, Mercy Ando. Yes,
I mean, always appreciative of all of you tuning in, enjoying, and enjoying the show as well.
From Dr. Phil.
The name is Dr. Phil now. You have great. Or I should leave you to do a small 1-2-1-2. All right. So that's DJ Phil, and always thankful to a host of you as well, who are part of the show, who enjoy what it is that we do for you here. I was talking about our friends with sickle cell.
Yeah, sickle cell.
Around these times, outside of the public health concern in itself. The cold and the present weather comes with all manner of conditions. So persons with rheumatism, for instance, will begin to feel it a bit more around these times, which will raise conversations about flexibility when it comes to work, right? Because persons had their entire homes inundated with flood waters. You need cleaning services. Some persons, I think yesterday when we were out, a number of my colleagues were out. Some churches had been completely overtaken by floodwaters. Wow. The church had people come, and they had been cleaning for 2 days, and they were still not done.
Yeah. The filth that the floodwaters carry is so serious. It's intense. So these things must be dealt with. And I agree with you that so some people are going to get some jobs done. Yeah, those who have the cleaning agencies.
Yeah, cleaning services will be better off. Mechanics, right? Yeah. Because lots of vehicles have had water enter their engines and all of that. Insurance companies will be seeing claims. We spoke to an insurance who says, look, they are happy to pay claims. All you have to do is prove
Oh, really?
Yeah, he says...
Happy to pay claims?
Yeah, he says they exist for times like these. That's why the insurance industry exists.
He must be very excited because I don't know any insurance company that is ever happy to be paying out claims. It's a lot of money to pay out.
Well...
So, this company, it's on the Atinka Road. There's a company there. There's
opportunity.
One of.
I know that on the Atinka stretch.
Yes. Look, the flood waters really devastated them. They were on the bottom. I mean, so when you get to the Abeno Junction, they are on the first floor, and that place slopes, and it's just right across from the Odo River.
It's terrible for them.
It is so terrible. So their whole place was flooded. I mean,
that Grand Digital Center
was also gutted.
In fact, there's been a reversal of an order because the entire place gone.
You see,
and so initially the management had said that look, some of the contract staff or others should bring in their laptops whilst they work to the communications minister has asked that order be reversed. But you know there are private business operators there as well. The passport office.
I've mentioned your name like 72 times. Mawina, listen to me.
It's crazy.
If we had wisdom, we wouldn't have put the Accra Digital Center there, or we could have placed it on stilts during construction. If you know that area very well, it comes from the Obechabi Lamte Circle, where we used to have the Audi company. That comes all the way through STC to, what's the name? State construction, SHT,
State housing company.
Exactly.
State housing company.
So from that side, all the way to
STC, State Housing Company,
all the way down to the Odo.
I know that
that place is not supposed to be habited by any building. So if that place has been flooding all these years, and we planned on putting the Accra Digital Center there, we should have planted it on stilts so that it goes high on pillars, so no flood water would hit it. But here we are, we built it as regular as normal, and this is what is hitting us.
Yeah, so
that is very sad. The digital center,
Accra Digital Center. The communications minister visited the police yesterday.
Too bad. So where OA bus or something?
All those buses.
Yes.
You know what they had to be doing? They had to be driving their buses and be parking on the overhead because.
Can you imagine?
There was no traffic on that day, and everybody was.
Can you imagine?
So that's what was trying to safeguard some of the vehicles. Let's get on to the phone lines now.
Right.
Amos Ando is the founder and executive director for Focus on Sickle Cell Foundation, FOSCEL. He's joining us. Mr. Ando, thank you very much for speaking to us. You're asking for certain privileges, but first off, perhaps we'll start like this, right? The challenges persons with sickle cell are most likely to be facing around this time of the year, which is prompting the call for a bit of patience and a bit of favor. I won't call it favor, a bit of sympathy be extended from employers and all of that. What are the predicaments at about this time of the year for persons who suffer sickle cell?
Okay, thank you, Marina, for having me here. Sickle cell disease is a major inherited genetic blood disorder in Ghana, and it is non-communicable disease. So it means that it cannot be passed from one person to another through contact. Instead, it is inherited when a child receives the sickle gene from both parents. So as at now in Ghana, it is estimated that about 18,000 babies are born with sickle cell disease every year. So upon the daily, day-to-day crisis that people living in sickle cell, they mostly go through, the current weather conditions continue to pose a serious challenge for people living in sickle cell condition. We have a condition for people living in sickle cell called the vaso-occlusive crisis. And then bringing it down to everyone to understand, it's called the rheumatism and sasabro in our local language. Over the past few days, a lot of sickle cell warriors have been calling us just because of this current weather condition and the vaso-occlusive crisis has set in. And we have received numerous distress calls from sickle cell warriors and their caregivers across the country. So we therefore urge all sickle cell warriors and their caregivers to take extra precautions during this period. So in everything that we are saying is that we want the sickle cell warriors and their caregivers to also protect themselves from not even get this severe crisis. By drinking plenty water also helps. So we urge all sickle cell warriors to stay hydrated. Always, you have to keep yourself very warm and avoid too long exposure to cold weather or rain. And then our caregivers we urge them to closely monitor the sickle cell warriors, the patients, and encourage regular fluid intake. If not water, it can be soup, it can be fruit juice, anything healthy. Keep them warm and never delay seeking medical care when the crisis develops. So all these things that we are calling for in response to this current situation, we have intensified public education and also engaged in the relevant health authorities. As at now, we've written formally to the National Health Insurance Authority, appealing for strengthened support by ensuring that essential medications that has been covered under the National Health Insurance Benefit Package for people living in sickle cell are consistently available and accessible to every sickle cell warrior who needs them. Because as at now, there are some medication that has been placed on the NHIS benefit package, which are the hydroxyurea, we have folic acid, we have brufen, we have petridine, tramadol, and other medications. Although it's not totally free, but it not being free, it has been subsidized. So you can get it at a low cost under the National Health Insurance Scheme Benefit Package. So that is what we are urging the authorities to make these medications available. And while the NHI continues to support this initiative, we are especially urging pharmacists at our teaching regional and district hospitals to ensure that eligible patients receive medication covered under the NHIS benefit package without unnecessary out-of-pocket costs, because we are receiving some costs also. That when you go to some of the hospitals, they will be telling you there's no medication, the medication that has been expected to be covered by the NHIS is not available and all that. We urge them, if it's available, they should make it more accessible for people living in sickle cell at this moment, because we really need them alive. We have also written to the Director General of Ghana Health Service, Professor Samuel Kaba, and the Chief Director of the Ministry of Health, appealing for coordinated national response to strengthen emergency care, support healthcare professionals, and ensure that sickle cell warriors receive timely, compassionate, and quality treatment during this period. Because at this point, a lot of sickle cell warriors will be having all complications, especially with the vaso-occlusive crisis, which is very sudden pain that can attack any part of the body. And it is very emergency, life-threatening, because if care is not taken, the person may even lose their life just because there's no accessible treatment, or treatment is not available on time. So this is what we are calling for, because as at now, the calls coming, the pressure the people living in sickle cell and their caregivers are giving to Full Cell Foundation shows that there is a need for us to also strengthen the support to make sure that we care for them. The treatment are being accessible for people living in sickle cell, so that this menace won't continue for long, because this weather itself is really cold and the rain is not stopping anytime soon. So we are urging the hospital facilities, especially some of our district hospitals, when sickle cell warriors, when they come to the hospital, because of how the pain is, they will be doing a whole lot of things, shouting and others. And we urge our nurses and doctors listening to us that they should manage to calm them. Sometimes because of how they are going through what, and there are some words and then any message that comes from some of the health professionals. Some of them even have decided not to even go to hospitals at all. Because as at now, if the crisis sets in and the person goes to hospital today, during the treatment and any other thing that the health providers will cater for them, the crisis may go off. I mean, you won't get the crisis again. You'll be relieved. But the next day, the crisis can set in again, and they have to take the person back to the hospital. And sometimes some words that health professionals speak to them and all that. We have all complaints around, because we are trying to make sure that everyone, through the health professionals, do their work very professionally, and sickle cell warriors also cooperate with them so that the treatment will be more accurate as we are expecting. And also, some of the medications has been, as I said, has been enrolled on the NHIS, and we do take it home, especially with the hydroxyurea. The hydroxyurea is not a treatment that maybe when the person gets the crisis, you have to take it or you use to treat the person. It's a medication that helps to manage not to even get the complications at all, the crisis at all. So it's a medication that they use to take it in the house, day in and day out. So we urge the warriors and their caregivers to take the medication timely. And the hydroxyurea and folic acid, you have to take it once in a day.
Right.
One folic acid, one hydroxyurea, once in a day, every day. So we are urging them to also cope with that and make sure that the medication has been taken timely, as the health professionals has also prescribed to them. So this is our call. Whilst we are calling on the government
to also
people living in sickle cell to also protect themselves from getting this severe vaso-occlusive crisis just because of the weather conditions.
Amos, I want to thank you. I was going to ask,
one question, just one question.
Yeah, Patrice.
Amos, have you thought about eliminating sickle cell?
Why not? You see, sickle cell can be eliminated. Myself, I'm also a person living in sickle cell genotype 8. Okay, so I'm a warrior myself, And I believe that awareness and education is the key to eliminate sickle cell from our system. As I said, a lot of people are living with sickle cell. 18,000 babies are born annually living with the condition in Ghana. And a lot of parents, when you ask them why you brought forth a child living with sickle cell, some of them are very ignorant. They didn't even know their genotypes before they set in giving birth or, getting to marry and all that. So my focus here is to create more awareness, introduce genotype screening more. Let the person know that even if you are AS, you shouldn't go for someone who is AS. And sometimes it helps when people living in sickle cell themselves comes out and share their story for you to see how dangerous the condition is, so that you won't even venture by bringing forth a child like that. And we also plead with the youth coming that, in fact, sickle cell disease, if you don't really have money and you are even a middle-income person, you can never, ever take care of the child that you want.
That's true.
There will be stress. The financial burden on parents who are having children living with sickle cell disease is not easy. So we urge the youth.
Amos, do you know what you have to do?
Say I do.
Right.
Amos,
you have to know your genotype, which is very true. And it comes down to that. And
Amos, draw a
education.
plan. You need to draw a plan and a strategy, because I can help you to do this thing. It's very simple. So the point is that churches and the assemblies and even the persons themselves never date if you are AS, if you're a carrier, AS, never date anybody who also carries AS.
Yeah, it's
SC or SS. So every AS, SC or SS should always go into a relationship with somebody who is AA.
Yes.
And we have to direct more AA people to marry the AS people, so we eliminate it gradually. So when you meet somebody and you want to start a relationship with them, ask them their blood genotype. That's the very first thing. Do not wait until you fall in love before you try to move away from it.
Yeah, that even becomes difficult.
Last year, we had a conversation with GNACC, which is Ghana National Association of Certificated Counselors, and we signed an MOU with the counselors. In fact, the counselors also have concerns. Their concerns is that, when through the counseling process, you have to go and do your medical checkups for the counselor to see that everything is in line, so that they proceed from one stage to another. And during the medical checks, when they find out that the couple, they are not compatible, and they tell them that, oh, look, your genotype are not compatible. You are AS, this person too is AS, so we won't advise for you to go ahead and marry. And sometimes some of them even move out from there. They won't even proceed.
Fair enough. That is one thing I don't like about counselors.
Then they will go ahead and then marry
and get married.
Another way that you like.
So we'll have an opportunity to have this conversation properly.
Yes.
But I think we need to be able to show people a bit more in terms of the effects of all of this. Amos Ando, thank you very much for joining us here on the show as well, Patrice.
Yes.
That's pretty much our show.
Like I always say, there's a solution to almost everything. There's a solution
unless
to 99%
we don't have brains. Yeah.
If we plan it in the next 20 to 30 years, we can eliminate sickle cell. 18,000 people born every year, and it's only a disease that is always affecting the black person. It's only the black person who carries the sickle. So the point is, don't wait until you are told to go and do a blood test. No, have your full blood
and be
count.
walking around with it.
Exactly. Ask the person first of all, what's your blood genotype, before you fall in love. Because I know 2 doctors who have married. Actually, they are all carriers, because they fell in love deeply before they realized
it's difficult to go back.
So don't fall in love. And I don't like counselors. Some counselors.
It's difficult.
Counselors will tell you, we don't break relationships. We only give you advice. If we don't break the relationship, how do we end up? Because these same people will come back to it complaining about what is going on in the marriage.
Anyways, let's do birthdays quickly before we run out of the studio. That's Patrice.